Now, when speaking about the management of the wound, we have to speak about what is called wound dressing. Ezekiel. Now, wound dressing is a very important aspect in the management of a wound. So, wound dressing is a very important aspect in the management of a wound. Now, you need to know that what? The wound dressing depends actually on the stage of the wound healing in which you are. You have the different stages, the inflammatory phase. Is it clear? And the inflammatory phase can be visualized on physical examination of the wound or the ulcer. You can know that this wound or the ulcer is at the level of inflammatory phase. The second one, you have the proliferative phase. The proliferative phase, when you have a wound at the proliferative phase, you can know that this wound is already in the proliferative phase by visualizing granulation tissues on physical examination. The next one, you are going to have the remodeling phase. There are stages, there are things that can tell you on physical examination still that you are at the level of the remodeling phase. And when you are at the level of the remodeling phase, you know already which product you have to use at that level. So let's start on inflammatory phase. What are the elements on the physical examination that can tell you that there is inflammatory phase? In the inflammatory phase on physical examination, you have signs of inflammation. Is it clear? You have signs of inflammation around the ulcer. Is it clear? So it tells you that you are at the level of the inflammatory phase. Generally, when there are signs of inflammation, it tells you that you are at the level of the inflammatory phase. Now, in signs of inflammation, you are going to have swelling of the surrounding. Is it clear? If you have edema of the surrounding and you have also production, you have edema of the surrounding, you have purulent secretions. Basically, purulent secretion shows that there is inflammation and there is death of the neutrophils, and the death of the neutrophils can be as a result of bacteria. Basically, you can have purulent discharge, you have swellings with purulent discharge, or even serous discharge. When you have serous discharge, it just means that it's interstitial fluid from the accumulation of the inflammatory product which is causing this discharge. If you have swellings of the surrounding with purulent discharge of the ulcer, or you have serous discharge of the ulcer, it's telling you that you're at the level of the inflammatory phase. Purulent discharge is telling you that you have death of the neutrophils or the pustules, and those death of the pustules can be as a result of bacteria. It can be as a result of infections or even malignancies. So that's the first element, swellings. The second one is that it's going to be tender. So another sign again of inflammation is that there is tenderness. When you feel at the level of the ulcer wound, it's going to be painful, and also at the level of the surrounding, it's going to be very painful. That in that case, you know that you are at the level of the inflammatory phase. Then when there is tenderness, the next one is that you have redness. You have redness of the surrounding. Generally, when you have very red erythematous surrounding, it tells you that it's another sign of inflammation. That tells you that you're in the inflammatory phase. The next one, after redness, you have loss of function. Is it clear? You cannot, if the ulcer extend at the level of the ankle, the patient is not capable of doing range of motion at the level of the ankle because it is very painful. Is it clear? There is loss of function of that particular limb. It is very painful. The patient is not capable of doing dorsiflexion, plantarflexion. Or let's take an example when you have a wound at the level of the knee. Is it clear? When you have a wound at the level of the knee, you have all the signs of inflammation. You are not capable of extending your knee. Why? Or flexing your knee. Why? It's simply because that inflammation is the one that causes the loss of function. It's too painful that you don't want to move the knee. So that's why you have loss of function in this case, in the inflammatory phase. Is it clear? So the next one is that you have said tenderness, you have said swelling, you have said redness, it's going to be warm. Is it clear? It's going to be warmed. So those are the different characteristics that you have in the inflammatory phase. Now, when you have the inflammatory phase of the wound healing, when you are at the level of the inflammatory phase of the wound healing, the product that you generally use is the product that is going to kill the microorganism resulting to the inflammation. Is it clear? And generally, the product that you can use, is it clear? You can do now the type of wound dressing that you do here now is now an antibacterial wound dressing. Is it clear? You do what is called an antibacterial wound dressing. Is it clear? When you're at the level of the inflammatory phase, particularly based purulent discharge that is coming out from it, you do an antibacterial wound dressing. Is it clear? And you can also do chemical debridement. Is it clear? You can also do chemical debridement. So those are the two major elements that you can do when you have a patient that has purulent discharge. You need to know that every time that you have a wound, is it clear, which is fast growing with microorganisms, is it clear, when you think that the wound is infected, particularly seen with discharges, is it clear, you need to do debridement in that wound. Is it clear? And debridement, there are different types of debridement. Is it clear? So let's visualize a bit debridement before continuing with the other elements of the wound dressing.